Which button? Okay. Hi there. I'm Keith Coffman from Mayo Clinic, and we're going to talk about autonomic dysfunction, specifically how to treat it and how to inform healthcare professionals about it who maybe haven't heard of it. And the reason for this is that, so I'm a child neurologist. In the world of adult neurology, autonomic neurology is a American Board of Psychiatry and Neurology board certified subspecialty. It is a known separate entity. In the world of child neurology, that's not the case. So most child neurologists have very little information about autonomic dysfunction and autonomic disorders. And I'm going to help y'all sort of solve that problem. So I have no money because I work in an academic medical center. Key points. What is the autonomic nervous system? How do autonomic dysfunction disorders present? What treatments are effective, and how to tell other people about this. Okay, so to follow up on Dr. Stinari's comments and talk, she actually gave a great introduction in terms of talking about autonomic dysfunction. I'm going to be a little bit more comprehensive. The autonomic nervous system is responsible for the automatic functions of the human, okay? So heart rate, blood pressure, respiratory drive, temperature regulation, intestinal motility, digestion. So I'm putting GI dysfunction in autonomic, bowel and bladder control, sweating, arousal state, so awake, alert, and sleep-wake cycles, okay? And then partially pain response, okay? So, and as Dr. Saab mentioned earlier, pupillary response. So all of these things are actually part of autonomic nervous system function. There are three branches to the autonomic nervous system. So the largest, if you will, is the enteric nervous system. So this starts in your esophagus and goes all the way down to your rectum. Your sympathetic nervous system, which is your really excited part of your autonomic nervous system. So your fight, flight, or freeze. We'll talk about that in a bit. And then we'll talk about its counterpart, the parasympathetic system, the rest and digest system. So here is a diagram from the autonomic nervous system, starting at the pupil and going all the way down to the groin and genitalia. And these are the two arms: sympathetic on the right, so red, hot, excited, and parasympathetic on the left, blue, cold, and chill, okay? So what happens when the balance of the autonomic nervous system gets severely disrupted? Ooh, typo, okay. So what happens if this occurs, where you get a huge surge of autonomic activity in the sympathetic system? So what we're talking about here is PSH, or paroxysmal sympathetic hyperactivity, also known as autonomic storming. So Dr. Ann Berg, myself, and Deborah Gabler-Spira published a paper a couple of years ago about this in the DEE population. First, we're going to talk about the definition of PSH. So what happens in PSH is you get this sudden onset of increase in temperature, heart rate, respiratory rate, flushing, sweating, drooling, agitation, and often, but not always, the presence of dystonia, which, as you heard earlier, movement disorders, and specifically dystonia, are part of the SCN2A phenotype. Many patients who have PSH have been having EEG after EEG after EEG because this looks like seizure. It looks like seizure. Get an EEG, it's not seizure. These are excruciating. They can last for hours. They can cause pain. They can cause injury. Key thing, EEG doesn't change during these events. And you're told, well, it's not seizure. Well, what is it? Okay, so here's an example. The most well-known example in this audience of a little girl who had really bad PSH early in life, who's now doing much, much better. But as you see, severe distress, pain, red, unusual posturing, and these would occur for hours and hours and hours, but she's doing much better now. The thing with PSH is you have to try to prevent it. So you keep the room cool, you keep light low, you regulate sleep-wake cycles, you really have to regulate bowel and bladder control, and you evaluate for sources of pain. When you use medications to try to treat PSH, unfortunately, the science is really terrible. Abortive therapy is really ineffective. Preventing these episodes from occurring is really what we do. So we use medications that decrease autonomic output. Okay, we use medicines like clonidine, which decreases the release of norepinephrine at the synapse. We use medications like propranolol. The key thing is you can't use those two together, because when you do, you drop patients' heart rate and blood pressure and they pass out. We use medications to treat pain. So clonidine, again, is a great medication for pain, as is gabapentin, and we do not use opioids in the treatment of this problem. And then we use medications to treat the dystonia, because sometimes what happens is you get dystonia that causes pain, that causes your autonomic storming, and if you don't treat the movement disorder, you don't get any better. So now we're going to talk about the opposite end of this. I heard in the opening to this session in the afternoon, the poor little girl who had the episodes where her heart rate would drop into the 40s and 20s. And this really is the opposite end of PSH. Okay, so this is autonomic insufficiency. Okay, so what happens in autonomic insufficiency is you get cold, sleepy, and slow. Okay, you have a decrease in your sympathetic nervous system output. You have a low body temperature. You're very sleepy. You get feeding intolerance because your gut slows down. You have an increase in constipation. You decrease sweating. Your heart rate goes low. And you slow your breathing. And you decrease how much you move. Because the autonomic nervous system can't keep up with what the body needs, so the parasympathetic system is doing everything it can to keep that rest and digest, but the sympathetic system says, I can't. I can't generate your heart rate. I can't generate your respiratory rate. We're tapped out. What happens here, duplicate slide. Okay, so this doesn't typically present with bursts of abnormal activity. This is more insidious, weeks to months, okay? Often mistaken for illness or infection. I don't know why your child looks sick. I don't know why your child looks like he or she has an infection. I can't find anything. Symptoms fluctuate throughout the day and night. And if patients are ambulatory, so we see this a lot in teenagers going through puberty growing, they stand up, they fall down because blood pressure doesn't compensate when they stand up, so they drop, pass out. Treatment for this is the exact opposite. Okay, so what we do here is we use medications like midodrine, which increases autonomic output, or atomoxetine, also known as Strattera. This actually, the way it works is it increases the amount of serotonin and norepinephrine, two autonomic neurotransmitters that if you come to my talk tomorrow, you'll hear more about, and Florinef, which makes your body hold on to salt and water better, so you keep your blood pressure up. And if all of those don't work, we go to ADHD medications, actually. We go to methylphenidate, which can be a short-acting or a long-term acting stimulant medication that increases heart rate, blood pressure, alertness, gut activity, and it comes in a variety of forms: oral, skin patch, liquid, things that are SCN2A patient-friendly. Okay. So in the last couple minutes, how do you tell people that haven't been to this talk, haven't heard this talk, what's going on? Okay. Give them something to read. Okay. Give them this paper. Okay. So this is a paper written, the paper I talked about earlier, by Dr. Ann Berg, myself, about how common autonomic dysfunction is in kids who have DEEs. 81% of patients or subjects in this study had symptoms, And the impairment, the negative functional impact and day-to-day quality of life was 90% in this study. Okay. Other ideas. Record them and show them videos. Okay. Going back to the Day Project clinical picture maker that Dr. Tiranoff and her team are creating. This is an outstanding tool to be able to show your healthcare professionals what's going on. Don't let them off the hook. If they say, that's not a seizure, ask them, then what is it? And don't take, I don't know, for an answer. Say, I've heard some talks about this. Maybe you want to look this up. Okay. And if they would be willing to, they can email me. There it is. Happy to help anybody. Closing thoughts. Autonomic nervous system must work in a balanced way to effectively function. Disruption in autonomic nervous system causes symptoms across the whole human. And these disorders are treatable if people recognize them. And that's it. And we're on time.